Davin Lim, Dermatologist. So you would like more on how to manage your rosacea using non-pharmacological methods, in other words, lifestyle changes as well as simple skincare. Well, lifestyle changes is really complex. There's many elements of flare-ups for rosacea, including climatic changes such as UV, wind, change of weather, change of temperature, and more. And that's manifested with redness, but also flushing and blushing when you enter an environment which is not norm. Now, from there are other things that can flare up rosacea, including foods, hot, spicy foods, coffee, tea, anything which may evoke inflammation in your skin or dilate your blood vessels. And that's manifested once again with flushing and blushing, but occasionally with zits and pimples and acne-like lesions characterized by rosacea. Additionally, there are other factors which may impact you. For example, the skincare that you're using, the irritants. Additionally, mental status, for example, stresses may flare up your skin. So it's immensely complex, and how we're going to work it out is that each patient will have a particular roadmap. So I always say this is much like an adjustment disorder. You've got a problem, you've got to adjust. The more analytical you are, the faster you adjust. And this is where I will talk about the 1% rule. Because if you change something, it may give you only that 1% gain. But if you change multiple things and analyze multiple things throughout your day and throughout your life, that 1% may add up to 2 to 3 to 4 and may go all the way up to 40 or 50% improvement. That's without the need for pharmacological manipulation. So for example, if you have warm showers, that may flare up your rosacea a tiny bit, and that may add 1% to your flare up. So you can decrease the temperature of your showers. If you rub your face instead of patting it, that can add another 1%. If you're using the wrong cleansers, the wrong soaps, or the wrong hair wash, that can flare it up by 1%. So in all of these little manifestations, you can change small elements in your life that will make your rosacea easier to control, and it's only you that can figure it out. Dermatologists can give you a hint, and we can point you out to really good websites, for example, rosacea.org. So when you modify all these small changes in your life, it may give you a bigger overall outcome. If you're really struggling, that's when dermatologists can help you. But I guarantee you, a dermatologist will prescribe you medication. That's what we do. We prescribe, or we treat you with laser therapy. So you might want to try these lifestyle changes prior to seeing a dermatologist. In the next 1 minute, I'll cover skincare. Basically, it's this: simple is best. With rosacea, you've got to be precise, you've got to be accurate with what you use in your skin, because you can't afford to muck around with topicals, which may flare up rosacea. So I'm going to give you a couple of hints. First of all, keep your cleansers really simple. So CeraVe and La Roche-Posay make really good ranges, including the Azelaic from La Roche-Posay or the Toleraine. From there, you can add Azelaic acid, something between 10 to 20%. It works as an anti-inflammatory. If your skin is inflamed and you want to calm it down and re-establish barrier function, a simple vitamin B3 or niacinamide can help with that. If you're using sunscreen, keep it simple. Something like a physical sunscreen with zinc or titanium dioxide is preferred to chemical sunscreens because they cause less irritation. So sun is often an implicator seen in about 2/3 of patients, which can flare up your rosacea. So be sun smart. From there, if you're still struggling, book an appointment with one of our dermatologists at Cutis Dermatology, and they will prescribe medications to control your rosacea and get you back on track. More at Cutis Dermatology.